Because of the outbreaks in the United States, including ours, we are under threat of losing that elimination status after 2 decades of being virtually measles-free as far as sustained outbreaks.
Utah is one of those hot spots in the country for measles. New data may explain why. Thanks for watching 2 News at 6 tonight. In the wake of a measles outbreak, new numbers show kindergarten vaccine exemptions are 15% higher in southwestern Utah than the rest of the state. Samantha Hoffman is live for us in St. George this evening. And Samantha, you've been going through some of this data. What stands out to you?
Well, the Southwest Utah Health Department says that most of their cases came from unvaccinated individuals under 18. So I explored how vaccine exemptions may have played a role in the rapid spread.
You know, over the past year, we had a few outbreaks that were fairly significant.
In Washington County, about 1 in 4 kindergartners are exempt from vaccinations.
Do you think that vaccine exemptions have been a benefit or a barrier in terms of student safety?
I think it's been more of a barrier for student safety.
Utah allows for students to be exempt from the measles vaccine for personal, religious, or medical reasons. The Department of Health and Human Services data shows kindergartners' exemptions have more than doubled in the past 2 years, now at about 12% statewide and 27% in Southwest Utah.
Our exemption rates even tend to be a little bit higher than the rest of the state, which has made us more vulnerable to an outbreak like this.
Only about 3% of the statewide vaccine exemptions are medical, with about 13% religious and 84% personal. But not all states follow non-medical exemptions. The states that have no non-medical exemptions have under 50 cases of measles, more often under 10 cases. So should Utah consider revoking the personal or religious exemptions?
I think we should always be open to conversations around general health care, public health, vaccinations, but that will really be up to, I think, the populace and their elected representatives.
The Southwest Utah Health Department says state health officials are now focusing on mitigation rather than prevention of the disease.
The big thing is to realize that public health, we can educate, we can try to affect policy, we can provide services, but that only goes as far as personal choice and responsibilities.
Well, Dunham and Heaton said that vaccine exemptions do give the benefit of parent choice. They recommend trusting the guidance of medical professionals for the benefit of all students. Live in St. George, Samantha Hoffman, KUTV News.
Samantha, thank you. We have noticed that cases continue to spread throughout the entire state, but numbers have steadied in southwestern Utah. Heaton, as you just heard from, touched on what has helped slow the spread.
We did see some effectiveness when we asked people, if you think you have the measles, try to call first before you go to a healthcare facility, and we think people listen to that. I think it's a wait and see thing. So people that are experienced, were actually infected with measles during this outbreak, now have that immunity. That's the silver lining there. But we'll have to see what this fall brings.
As you heard, he mentioned the fall. So Samantha, what else did he say about what the fall and this possible new school year could bring?
So as I mentioned, there is hope for that group immunity, but as far as concerns, that goes right back to the vaccine exemption rates. He says that if a group of unvaccinated people come into school and there's a resurgence, we could see that spike right back up. And while numbers have gone low now, wastewater treatment has detected some measles still in the area, so that spike could be possible.
All right, Samantha.